You guys are so lucky you listened to chapter 17 notes today. I'm jealous. So, section 1, section 2. Let's get started. So, here's our first section. We're talking about health hazards for a population of people. So, it's broken down in different categories, but to start off with, let's discuss this term right here. So, when we talk about health hazards for people, we talk about risk. And this is a measure of the likelihood that you're going to suffer a hazard. And that hazard can be anything from a physical injury, a biological injury, anything along those lines. And they're listed down here. There's biological hazards, chemical hazards, physical hazards, cultural hazards, and lifestyle choice hazards. And so risk is looking at what's the likelihood of that happening. So we're not looking at individuals. We're looking at the potential, the possibility. Could it happen? The probability. How likely is it to happen? And so we're focused on that for populations as wholes. And so section 2, let's talk about some of the different types of hazards that are out there. So first of all are biological hazards. So sources of biological hazards can be varied. So bacteria are one type, viruses, insects, all of these can be biological hazards, but so can plants, animals, and other humans, birds. And so anything that's a living thing that creates issues for humans are considered biological hazards. And so they can cause all kinds of different problems, from skin irritations and allergies through infections, cancers, or, being eaten by a bear, for instance. So all these fit in there. There are two symbols that usually denote this type of stuff, and they're listed right here to kind of warn you and let you know that you should be cautious, have a little precaution when you're working with them. Now, when we're talking about moving these hazards from one place to another, we talk about the spread or sharing of these biological diseases. So there's two big flavors of that. There's non-transmissible diseases. And so that's when somebody gets it, but it can't go to another person. Like if you have heart disease, you can't give that to another person. If you have cancer or asthma or diabetes, these are human hazards, but they can't be sent from one person to another. You can't cause it in another individual. And then there are infectious diseases that actually do get passed from person to person. So bacteria and viruses are good examples of that. Here are three specific examples. Measles, tuberculosis, and malaria are all examples of infectious disease. And so transmissible then is the term that implies that they're contagious, or they can be passed from one person to another person. And these would be examples like influenza and HIV that can be spread from person to person. So around the world, when we're looking at infectious disease, it accounts for quite a few deaths. 12.5 million per year die from these major 7 listed right here. So bacteria and viruses leading to pneumonia and flu is the number one killer along these lines, followed by AIDS and HIV, which is mainly in Africa. Then like the choleras and things like that of the world that cause diarrhea-based diseases, usually from poor water sources. Tuberculosis is next, and that one's on the rise because there's resistant bacteria tuberculosis, or resistant antibiotics tuberculosis out there, which is causing some problems. Malaria kills quite a few people a year. Then you have hepatitis and measles. These account for the vast majority of the deaths, 12.5, 34,000 a day. Most of these, if you make note of, are happening for poor people in developing countries. And the vast majority of them can easily be prevented if we made the effort to do that. So, infectious disease, still major threats. So, not as bad as they used to be, though. In the 1950s, deaths from just infections was very common. Like you get a scratch or a cut or a tear or have surgery, and you had high probabilities of not being successful. After the 1950s, antibiotics came online, vaccines were developed, and we developed better healthcare techniques in general that enable people to live longer. The infectious of diseases and understanding how they spread from person to person, we understand that better, and we're able to curb those a little bit more. But back in the day, they were spread very commonly because people didn't really understand. And when we talk about this spreading of major health threats around the world, we talk about two terms: epidemics and pandemics. An epidemic is when it's spread over a large area. So there might be an epidemic. There's an epidemic of Ebola in Africa right now. Pandemic is when that infects the whole globe. So having a little bit in the United States and a little bit in Europe doesn't really make it a pandemic. Having large quantities in all those places creates pandemics. Specifically with antibiotics, the reason I don't like antibiotics, hand soaps and things like that, have to do with resistance. So bacteria will become genetically resistant to antibiotics over time. The more we use antibiotics, the more they cause problems, or the more the bacteria react to them, then create genetic defenses against them, and then they stop working properly. So genetic resistance is a natural thing, but we're misusing antibiotics all the time, and as a result, we're creating superbugs where our antibiotics aren't working anymore, and so that's a scary place to be. So, like for instance, if you go get penicillin, the amount of penicillin you have to take versus the amount of penicillin that people had to take for the same thing when penicillin was first introduced is vastly higher now from simple genetic resistance. And then we overuse antibiotics. We use them for all kinds of things we don't have to. It's found that half of the antibiotics that are prescribed to treat things in humans didn't need to be used at all. Sometimes it's preventative. Sometimes somebody goes into the doctor and complains they got a cold and they want antibiotics when it's a viral cold and antibiotics don't do anything. So that misuse of those is creating more and more problems. And then other factors. Rapid spread of disease because of the population and the way people travel around the globe. And then overuse of pesticides and antibiotics in animals also create these problems. So viral diseases that kill lots of people. So when we talk about viruses, what viruses are really hurting people? And it's keep in mind, you can't treat a virus with an antibiotic. Antibiotics only work on bacteria. So which ones do that? Influenza, the common flu. HIV turns into AIDS and hepatitis B. These are the big three that really kill the most people yearly. Now, there's a couple that are on the rise, and we hear about West Nile and SARS, but the truth of the matter is those are fairly small quantities. And influenza or the flu is the greatest killer worldwide. Just so you know, the flu virus lives in us, but it can also be spread into pigs, ducks, chickens, and geese. And then from that, it can come back into our species. So it can mutate and move back and forth between the two. So even if we killed all the flu in people, it could still come from these sources. So that's an interesting piece of information to have. AIDS, acquired immune deficiency syndrome. I'm not going to get into a great bit of detail on it, but here's the virus, the human immune deficiency virus, the HIV, which eventually leads to this acquired immune deficiency syndrome. Your immune system shuts down. It's the second biggest killer worldwide, and the truth of the matter is the vast majority of those people get killed in Africa. So it kills about 2.1 million people a year. 2.5 million are infected every year. And what it does is it weakens your immune system, and then you die from something else that you get. Right now, there's no vaccines to prevent or cure AIDS. There are things that are helping out with it. The truth of the matter is they're extremely expensive, and they're helping people live a lot longer, but they're not there yet. Malaria is another interesting one. Malaria kills a lot of people, especially in third world countries. And so it's passed by mosquitoes, and it's this little teeny tiny bug basically that hangs out inside the mosquito. The mosquito bites you, and it infects you. It infects you through the bite, and then that little bug there destroys your red blood cells. It gives you intense fever, abdominal pains, vomiting, and headaches. It's not a pleasant thing once you're infected. What's happened since the 1970s when malaria was really, really rampant is there's been drug-resistant forms of the bug. Insecticides have created resistant mosquitoes that can live through things easier. And so global warming's had an effect on it, and AIDS patients are really vulnerable to it. So malaria is a thing that's not going away. It's not an old problem. It's a current problem. Ways to prevent it. Here's a list of them. They're in your book. I recommend that you look through them. Malnutrition and poverty and washing of your hands. There's a lot of things you can do to help take care of yourself and protect yourself from those issues. That's the first one. Bye-bye.